this body map technique that I've been doing for 20 years. So I'll tell you how to do it. What I want you to do is you draw an outline of your body front and back, and then I want you to think of a traffic light, and I want you to color this outline front and back in the colors of the traffic light. So green means go, I like to be touched there. Red means no, please do not touch there. And yellow means it depends. And the it depends can mean a whole lot of different things. So one very common thing that women have is their breasts and their genitals will be yellow because it depends. I want to be touched in a whole body way before you touch my breasts and my genitals. Or maybe your breasts might be yellow because how you feel about having your breasts touched might depend on where you are in your menstrual cycle. Or maybe a part of your body is yellow or red because you don't like the way your partner is touching that part of your body. Or, unfortunately, a part of your body might be yellow or red because you feel shame in that part of your body. And a perfect example of that is how many women have red or yellow around their bellies. And that comes from the fact of the way women are portrayed in the media. So I'm sure you somehow know, but I'm going to remind you that these pictures of these models that you see in the magazine, these women are very thin, they're unusually thin, they don't eat for days before they're going to be shot, and then they work on those pictures with Photoshop. So you have these skinny, skinny, skinny women, and then they've been Photoshopped. So they have these flat bellies that are completely abnormal, but we're looking at them anytime we pick up a magazine. So
I would like to add something in there about the belly, that there's a lot of research now about the number of neurons in there and the neurotransmitters, like there's dopamine, 50% of the dopamine and 95% of the serotonin in that abdominal area. So when we don't pay attention to it, we don't like it, and we have tension there, it's adding to our emotional upset.
Isn't that great to know that? But what I want to say is, even, as a sex therapist, I might feel really bad that women, and be sad that women don't want to have their bodies touched and their bodies are red or yellow. But as a practical person, if that's how you feel about your belly, fine, color it red or yellow, because in fact, the most important thing is that you get the consistent kind of touch that arouses you and relaxes you and makes you feel wonderful. And you'll get thrown off if someone touches a part of your body that you don't feel good about. So even if Erica and I don't feel good about the fact that you don't feel good about your belly, if that's how you feel, color it the way you feel, because this is the map for your partner.
No, what's beautiful is that you're non-judgmental about it. It's all about the person really telling the truth to themselves.
To themselves and to the other person, because you want to get lost in the sensation. And anytime someone touches a part of your body that doesn't feel good, you have a startle response. So instead of going into that dreamy place of loving to be touched, you go, ah! You get a startle. So that's what you're going to do. You're going to draw your body front and back. It can look like a gingerbread cookie. And then you're going to color every inch of that, one of those three colors. So you kind of have to go into your mind and imagine how you like to be touched. So I want to show you, hopefully it will show up. I want to show you this diagram, and we will put it online as well. So this is something that I published. So these are templates. I don't want you to use a template. You can just use a sloppy drawing. It doesn't matter. And it's more fun to draw your own body. But I want to talk to you about what we see in some of different women. So hopefully...
That's good. Yes, you can.
Okay, so I want to talk to you about this person. Her name is Avery. I call her Avery because she's Avery woman, this very common body map. You see that she has a lot of green, and her breasts and her vaginal area are yellow because she wants to be touched all over her body before you touch her in her breasts and her vagina area. And she also is a little ticklish, so you see those red spots. But she isn't exactly Avery woman. I would say she's Avery very lucky woman. So she's a woman that's either come from a very wonderful, loving family, or she's a woman that's come from a family where nothing went wrong. There was no physical abuse, no sexual abuse, no neglect. She didn't witness anyone being hurt, no emotional abuse, because all of those things leave a path on the body. So that's Avery. And contrary to Avery, this person down here, I forget what I call her. I called her Yolanda. And this is one of my patients, this is in her drawing, who had sexual abuse and emotional abuse and physical abuse. And you can see that there are very few areas on her body where touch feels good. And of course, she does not enjoy sex. And we like to say the issues are in the tissues. The issues are totally in the tissues. All these memories of any kind of abuse or neglect or being bullied are all stored in your body.
But I would like to just add that that person has green on her head and on her feet, but I have worked with clients, since I do body therapy, who don't want their feet touched at all or don't want their head touched.
Mm-hmm. It's totally idiosyncratic. That's why everyone has to do their own body map. It's not going to be about anyone else's, and it's a really wonderful way to communicate with your partner about what you like. So then I want to talk to you about this person whose name is Bonnie, and Bonnie has red on her belly and red on her face, and Bonnie didn't have any kind of overt sexual abuse. What Bonnie had is physical abuse. Her mother used to scratch her face whenever she would, quote unquote, be fresh. And so Bonnie, who was in love and enjoyed sex for the first year of a relationship, when a lot of people have different hormones in their body and you're into a lust phase, as soon as she got out of the lust phase, she stopped liking sex and she was completely baffled by it. And as we processed her body map, she started to talk about all these traumatic experiences with her mother, but it wasn't overt sexual abuse. It's what I call developmental sexual trauma. Developmental sexual trauma is things like neglect, physical abuse, witnessing physical abuse or family violence, emotional abuse, bullying, or you could actually have a map like this if you had had some kind of adult onset abuse or neglect or rape. But anyway, if it's in your family, I call it developmental sexual trauma, even though it wasn't overtly sexual. And it's very important that people recognize this, and I find that a lot of people don't. So if you have a body map like Bonnie or some of these other people that aren't Avery, and you see that you have a lot, I'm going to put this down now because it's in the way. But if you see that you have a lot of red and yellow and not very much green, that's really important to know. And it means that touch in all those areas that are red and yellow is not going to feel good. And past the falling in love lust stage, touch is completely critical for most women to feel interested in sex. So if you want to transform your sexuality, then you need to work on it. But I don't want you to work on it yourself. I want you to get a trauma therapist.